I would say thank you to Augin Committee 2021 for giving me this opportunity to present our case report titled Persistent Cervicitis Mimicking Cervical Cancer Appearance. How to distinguishing? Okay, I'm Kelly Julianti from Obstetric Gynecology Oncology. Want to present this case report. Okay, cervicitis and invasive cervical cancer are totally different, but in clinical finding it often confusing. Usually in macroscopic appearance, it looked like cancer, but after the biopsy, the diagnosis was inflammation. Only a few studies had discussed cervicitis mimicking cervical cancer due to infection. Some of them caused from infection. It's very important to learn the sign of inflammation between cervic portio and cervical tissue that already changed become cervical cancer. Chronic cervicitis also can lead to some complication. Our case is 27-year-old woman that was referred to Dr. Cipto Mangunkusumo Hospital with vaginal dyssynekia with a history of abdominal pain in 2 months and also experienced or felt shallow during sexual intercourse. Patient already gave birth once in June 2019 using cesarean section of indication uh, her history of epilepsy. She missed her period for 18 months after using hormonal contraception. uh, the patient had experienced postcoital bleeding before pregnant, but now there was no vaginal bleeding or discharge. From the physical examination, with its speculum, found a mass in the top of the vaginal size 2 centimeter, no bleeding. In this picture, we can see the examination from the outside of the cervix without inspection. There was also a keloid scar in abdominal skin surface size 8 centimeter. There was no abdominal mass, no cervical, no uterine mass, and cervical enlargement in palpation. Ultrasonography was done, and there was hyperechoic mass and hypoechoic mass. The length from the mass to cervix portion was 1.33 centimeter. There was no enlargement of the right and left lymph nodes. It suspected cervical cancer stage 3A with different diagnosis vaginal cancer. From the MRI, we can see the thickening of the cervix to distal vagina, but in this picture, it cannot see the inflammation. And also from the biopsy, showed that it was fibrotic stroma with scattered lymphocyte cells that could be interpreted as chronic cervicitis. From the signs symptom imaging of the patient, we can conclude that the last diagnosis of this case is cervicitis. As we know, keloid could come from the post-operative after surgery that the patient had in 2019 with cesarean section, with transversal section. The history of vaginal discharge and intermenstrual bleeding was declined due to the most common symptom of cervicitis, but sometimes cervicitis or chronic or persistent cervicitis is also asymptomatic. There are multiple agents that can cause cervicitis, one of them from infectious and also from non-infectious agent. A microscopic examination was needed to confirm the existence of cervical inflammation and to quantify PMN in endocervical secretion. For the diagnosis, the chronic cervicitis could be caused vaginal synechiae and stenosis that might be rare. Some studies showed that in keloid scar there was the expression and activation of ezrin. What is ezrin? Ezrin is a member of ezrin, rhodopsin, and mucin family in protein that act as a regulator to cell of, of cell-to-cell interaction and extracellular matrix density and stiffness in tissue remodeling during wound healing. So we suspect that azrin expression was high in this patient's cervix. Azrin examination could found in immunochemistry examination, but we have not examined the azrin. Um, to differentiate the cervicitis and cervical cancer, it also can use PET scan, but in this case, we do not do the PET scan due to health insurance of this patient. The conclusion is this case cervicitis mimicking cervical cancer needs systematic diagnosis management. Due to the condition, we decided to do some follow-up every 4 months or 3 months to prevent the incidence of cervical cancer in the future, as the most common fourth cancer cause of death. That that was my presentation. Thank you for your attention.